Welcome to this podcast for the Temasek Shophouse Conversation, First 1,000 Days, Maternal and Child Wellness. We're having this segment because earlier this week, many of you had questions of the panelists and we didn't have time to answer. So I'm really glad to have with us today Dr. Salam Soliman, who was there that morning with us. She's the director from the Center for Prevention and Early Trauma Treatment for Child First, hailing from the States. Hi, Salam. Thank you for joining us.
Helen, thanks for having me.
There was a question for you. While there are many factors that affect the child's development and well-being, what are the key biopsychosocial factors, components that will impact long-term human potential during the child's early years?
Sure. So from my perspective, early positive relationships are the most important factor in ensuring a child's well-being. That's not to say that a child doesn't need concrete needs and their basic needs met. They certainly do, and it's important to pay attention to that. But without that nurturing early relationship, the child will not fare well. And the reason for that is that humans require a lot of caregiving after birth. They're more immature than any similarly sized species and are very dependent on their caregiver for much longer. The caregiver is needed to provide basic scaffolding for the children in those first early years and sometimes beyond. And what happens is that from a kind of a neurological perspective, in the gestation period and beyond, there's a lot of activity going on in the child's brain. There are what people refer to as sensitive periods and during this brain development, where the brain is thought to be very plastic, which means that it's very responsive to the environment and what's happening in the environment around it. And because of that, the timing of potential events and in the environment for the child during those sensitive periods is really disproportionate because of the sensitive period, so that the impact of anything that happens during that time is really disproportionate. This sensitive period is thought of to be during early childhood and also during adolescence. And during that time, the child's brain experiences what we call a neural overproduction, which means that there's a lot more dendritic connections than what we need. And so the nervous cells, the neurons are making a lot more connections than we actually need as adults. And following this overproduction is what we call a pruning period. And so during the pruning period, there is a selective elimination of connections based on those sensory experiences. So any connections that were not used are essentially pruned and eliminated. Some researchers refer to this as the use it or lose it phase of brain development. And the reason why this is so vital is because those connections are based on the child's experiences. So the more positive experiences the child has, the more these connections become strong and solid and stable. And the reverse happens if there's been negative interactions and experiences. And this process, the reason this happens is because it leads to increased efficiency. So there's fewer connections in the brain that can focus on what it needs to focus on. It's kind of like moving from a dirt road to a highway. And this process impacts every aspect of our development, not just our brain, but it certainly does impact our brain in terms of the sensory pathways and language and other more complex functions. But it also impacts our immune system, our neuroendocrine system. They all share the same chemical messages. And so children, what we learned from experiences, both intended and unintended, is that children who experience abuse or neglect or are in institutional care, like, for example, the Romanian orphanages, have devastating outcomes. And so what happened is in the 1960s, Romania had a ban on all forms of contraception, which led to a lot of children being abandoned in orphanages. And these children were often left for up to 23 hours in their cribs with almost no human interaction. It's important to note that these children did have their basic needs met. So that meant that they were diapered, they were fed, but they lacked really any what one would consider typical human interactions. And these children survived, but their survival, the way they had to adapt in order to survive was really striking. They had severe stunted growth, impaired IQ, and emotional and behavioral impairments. And you may have seen some pictures from the Romanian orphanages. They were extensively studied, and they're striking in the sense that sometimes you would be you see a picture of what you would think is a 2-year-old, but she's really 10. And so the severity of the impairment in her and the children's development was really quite striking. Studies like these, along with many others, really cemented the importance of what we call the serve and return, which is the attuned, nurturing interaction between a caregiver and their child, especially in those first years, and the importance of that serve and return for the child's healthy physical, emotional, and psychological development. Without it, the brain volume is smaller. Our centers in the brain are impacted, most notably our centers for fear, our centers that anticipate threat and respond to it, and many other functions in our brain. And so in some, without the appropriate level of attuned interaction between a child and at least one primary caregiver, the child may survive, but at great cost to their overall development. And so, Helen, I now have a question for you that came from the audience, and they asked about how stunted growth, such as, for example, suboptimal physical development, resulting from malnutrition among children of low socioeconomic status, may impact long-term potential.
Thanks, Salam. This really connects with the rich sharing you just gave us about how stunting can happen from lack of emotional nurturance. So if you think about it, if suboptimal physical development is clearly visible to everyone, what will that mean at the internal level with brain development? So stunting, low wealth, and malnutrition are significantly associated with neurodevelopmental delay, and certainly long-term potential will be adversely impacted. This is perhaps one of the reasons why our global community must work together in this very challenging time of COVID-19 to ensure equity of resources, nutrition, and healthcare for the next generation, because we really are so interconnected and interdependent, one nation on another. So the audience also had asked about what the local perspective here in Singapore. What can be the role of fathers and mothers in the first 1,000 days? I have to say, living in Singapore, the demands of sustaining families in our affluent society is real. We are, after all, the fourth most expensive place to live in around the globe. COVID-19 has especially made it very challenging for low-income families who might struggle with additional stress and mental health issues. So that just thinking about basic needs is already weighing down on parents. So being aware of the importance of the first 1,000 days in the development of the child is a first step for mothers and fathers, recognizing that the well-being and health of the baby starts in the womb. It's not possible to do everything perfectly, but small bits can all add up to nurture the growing child as best possible. Talking to baby in the womb, just saying good morning, good night, it's easy and it's free, and can help to nurture maternal attachment, which buffers for perinatal depression. Recognizing that baby has a mind of his or her own and is influenced by caregiving, so that parents need to keep mindful and responsive as best as they can. It's what you shared about, right, Salam, on that day, about how it is important to have responsive relationships for children to be nurtured well and to grow healthily. So this is really quite different from what a lot of us grew up with, thinking about how it's commonly said that babies can't remember or they can't notice. So that's not really true. As a couple, parents can also build their relationship strongly, because this will make sure that the child will grow up in a home environment that's stable and nurturing. And definitely, should couples feel they have difficulties communicating or difficulties in their relationship, it's important to get help. And lastly, just thinking about how the first 1,000 days creates the foundations for their lives as parents for their children is really what we're advocating for in this conversation. So this question really heartens me for our Singaporean kids. So I've got a last question for you, Salam, from the audience. I think you'll really be able to teach us all, myself included. What is the mothering advice you have for mothers-to-be who have Asperger's or are on the spectrum?
Thanks, Helen. And thank you for your responses to the previous questions. That was really useful and helpful for me to hear. So as it regards to this question, one has to consider the areas where someone that might be on the spectrum or someone with Asperger's might be struggling. And the areas that one typically considers are general discomfort in social situations, and particularly with eye contact. And sometimes rigidity about certain routines, and also sometimes certain topics. And as you can imagine, all of these are areas that are so vital for a good relationship in general, but also in particular with a baby. And so one of the things to advise a parent that might be on the spectrum that's expecting a baby is to provide them with a couple of really basic and concrete tools that they can do easily, and that they might have an immediate response from, and so it may kind of reinforce doing those things. The first thing that we encourage is telling them to imitate their baby's gestures, and that should happen right from the beginning, and especially important in the first year. But if the baby grimaces or does a funny face, or just imitate the baby with your face. Do what the baby's doing. And although a parent might feel silly at the beginning doing that, what happens is that one thing that happens is that they start feeling more connected to the baby, because they're when you imitate another person, you kind of almost imperceptibly feel connected to them, and feel that you're like them and they're like you, and so that's really helpful. And then the other thing that happens is the baby becomes really interested in the parent's face, right? They're kind of curious. They're wondering what the parent is doing. And that in itself is reinforcing, right? Because the baby will then respond in an interesting way to the parent. This is really great, especially in families where there may be a predisposition to not being interested in faces. And so this focus on the face and the facial gestures is really important. Another easy thing for a parent to try, and it's really important for all parents, but particularly important for a parent on the spectrum, is to work more on commenting on the baby's behavior and less on trying to control it or trying to direct it or prompt the baby in a particular way. And so practicing with a parent, just noticing what the baby's doing and saying something about it. This is really important for the child in terms of their language development and emotional regulation, but really important for the parent to learn to step back and not try to impose a lot of rigidity around their parenting. And so, for example, if the parent is trying out a new food with the baby and the baby does like a funny face, and when they try it, a parent might say, "Oh, you didn't really like that," or "It looks like you didn't really like that," instead of saying, "Oh, you should have more," or that it's important that you eat this food, or whatever. So doing more commenting and noticing and less prompting. So as always, paying attention to the baby's cues, doing lots of imitation and a lot of face-to-face work guided by the baby's signals when the baby wants more, and then learning when the baby's done and stepping away from those intense interactions. So that's it in a nutshell. And thank you for having me here, Helen.
Thank you. I think I can surely use those tips with moms I will see. Thank you, Salam. We'll turn now to welcome Associate Professor Chua Chen, Head and Senior Consultant, Department of Neonatology, Director, Human Milk Bank, KK Women's and Children's Hospital. Hi, Chen. I wonder if you could answer this question from the audience. How does breastfeeding figure in supporting the mother-child diet for better health outcomes?
Breastfeeding provides the necessary nutrients for growth and developing immunity. It also promotes bonding between mother and baby. It is well recognized that exclusive breastfeeding in the first 6 months is central in promoting long-term health. The 10 steps to successful breastfeeding, which is integrated into routine newborn care and practiced in all accredited baby-friendly hospitals in Singapore, focuses on helping mothers to establish exclusive breastfeeding before discharge with minimal separation between the mother and baby diet. The Integrated Maternal and Child Wellness Hub, established in Punggol Polyclinic in collaboration with Temasek Foundation, is a pilot project which delivers care to mother and baby as a diet. And this has shown promising results with increased breastfeeding rates. And there are plans to scale up this model of maternal and child health delivery in the community in future.
Thanks, Mei Chen. There's another question. How do we continue breastfeeding while at work? And what can we do to improve the breastfeeding rates in mothers employed in the service sector and in the informal work sectors?
We can support women to continue breastfeeding after their maternity leave in a few ways. Firstly, we can encourage mothers to sign up for talks and workshops to equip themselves with the practical knowledge and skill on how to provide breast milk for their babies after they return to work. These talks are regularly conducted by KK Women's and Children's Hospital, the Breastfeeding Mother Support Group Singapore, as well as Joyful Parenting. Employers can consider transforming their workplaces to be more breastfeeding friendly by setting up lactation rooms so as to offer nursing mothers more privacy when they're expressing milk. Should they encounter difficulties in this area and require advice, they can contact the Association for Breastfeeding Advocacy Singapore for consultation. In addition, employers can consider having scheduled pumping breaks to better support breastfeeding mothers. And last but not least, we can all support our fellow workers and colleagues by understanding the need for breastfeeding mothers to take breaks to express and store milk for their babies.
Thank you, Mei Chen. That was really insightful. There was a last question now about where women can seek sources of support for postnatal depression and anxiety, and where can they go to get subsidized help. So I'd like the audience to refer to the QR code that's being flashed now. On it will be a nice information booklet that you can refer to, and the resources are in there. And with this, I want to thank all of you for joining us in this podcast to learn more about the first 1,000 days. And I want to thank Dr. Salam, Soliman, and Associate Professor Chua Chen for joining us this evening.